Today in Civic Education we examine HIV/AIDS from a human rights perspective. You may have studied the biological aspects of HIV in your biology class. Here, our focus is on the civic dimensions, the rights of people living with HIV, the responsibilities of government and society, and the policies Nigeria has put in place to address this epidemic. HIV stands for Human Immunodeficiency Virus. It attacks the immune system, weakening the body's ability to fight infections. AIDS, Acquired Immune Deficiency Syndrome, is the most advanced stage of HIV infection. According to the National Agency for the Control of AIDS, Nigeria has approximately 1.9 million people living with HIV, the second highest burden in the world after South Africa. Despite significant progress in treatment and prevention, stigma and discrimination remain major barriers to testing and care. Addressing HIV/AIDS is not just a medical issue, it is a matter of justice, equality, and citizenship. HIV is transmitted through specific routes: unprotected sexual intercourse with an infected person, sharing needles or syringes, transfusion of infected blood, and from a mother to her child during pregnancy, childbirth, or breastfeeding. HIV is not transmitted through casual contact, hugging, sharing food, using the same toilet, shaking hands, or insect bites. Prevention methods include abstinence from sexual intercourse, being faithful to one uninfected partner, and condom use, the ABC approach promoted in Nigeria. Other prevention strategies include voluntary counseling and testing, prevention of mother-to-child transmission programs, and the use of pre-exposure prophylaxis for high-risk individuals. Treatment with antiretroviral therapy has transformed HIV from a death sentence into a manageable chronic condition. People living with HIV who adhere to ART can live long, healthy lives and have an undetectable viral load, meaning they cannot transmit the virus to others. Nigeria's National Action Committee on AIDS coordinates ART distribution through public health facilities, with significant donor support from PEPFAR and the Global Fund. The rights dimension of HIV/AIDS is central to civic education. People living with HIV are full citizens entitled to all constitutional rights. Key rights include the right to privacy, no one may disclose a person's HIV status without their consent, the right to non-discrimination in employment, education, and healthcare, the right to access treatment and care. Nigeria's national HIV/AIDS policy affirms the right of every Nigerian to access ART, the right to marry and form a family with appropriate counseling and prevention measures, and the right to participate fully in public life. Violations of these rights are unfortunately common. Stigma forces many people to hide their status, delaying treatment. Some employers wrongfully dismiss HIV-positive workers. Some hospitals provide substandard care to HIV patients. Nigeria's HIV/AIDS anti-discrimination provisions prohibit discrimination on the basis of HIV status. Citizens should know and assert these rights and report violations to the National Human Rights Commission. As civic-minded young Nigerians, you have both rights and responsibilities in relation to HIV/AIDS. Your responsibilities include getting tested if you are sexually active, treating people living with HIV with dignity and respect, refusing to spread myths or stigmatizing attitudes, and advocating for equal access to healthcare. A truly civic response to HIV goes beyond personal risk avoidance to community solidarity. Supporting a friend or family member who is HIV positive, speaking up against discrimination, and participating in health campaigns are all civic acts. The Nigerian government's commitment through NECO, state agencies, and international partnerships has brought significant gains. New HIV infections have declined, more people are on treatment, and mother-to-child transmission has been dramatically reduced. These gains must be protected and expanded. Every citizen who is informed, compassionate, and active contributes to making Nigeria a country where HIV/AIDS is defeated not only medically but socially.